Hi, I'm Professor Siobhan O'Neill. I'm the Mental Health Champion for Northern Ireland.
Hi, I'm Professor Victoria Sims and I'm the Research Director in the School of Psychology at Ulster University. So Siobhan, what do you see the value of being a university professor and the mental health champion?
Well, that's a really good question. It was really important for me that I continued in my role as a university professor while I was doing this job because it gives me that independence. You know, I'm a scientist, I'm an academic first, and that's the base from which I provide guidance. You know, and that's the lens through which I analyse the world and analyse what's happening. And the independence is really important as well. So my role is as a critical friend. So I criticise what government do, but I'm also providing guidance as to what they should do and gently trying to get the change that we need based on the evidence that we have as to what the population needs in terms of their mental health and well-being. So having that dual role is it's really fundamental to who I am nearly, and that's just so important for me to do the best job as mental health champion. It's because I'm coming at this as a university professor, as a professor of psychology.
Yeah, and I think that it means that you're at the coalface of both, that you're really deeply embedded in the research and the research processes and the research community, and you're also embedded in the general, our Northern Irish population, and you're out and about, you're seeing the research questions arising, you're seeing the practical questions arising, so that interaction between these two things, they're kind of symbiotic, aren't they? They're feeding off one another. They're really helping to get the best out of this role. And I think you wouldn't be doing your best if those two things weren't working hand in hand.
Well, that's it. And also from the university's perspective, there is more of a focus on impact.
Yes.
You know, we want to be funding research that can actually change things, research that's really relevant socially. So that drive towards creating an impact is where I am. I think in terms of the university, I'm still doing some bits of research though, you know, and I'm applying for funding for specific projects that look at mental health and well-being in the population. So I'm still doing that research in the university with a whole load of other collaborators and teams and students, and then but really thinking about doing research that's more relevant to this role as mental health champion and more relevant to what research evidence the government need in terms of planning their policies and services going forward too.
And I think from an Ulster perspective, we regard ourselves as the Civic University, and we like to describe ourselves as that. And you being in this role really epitomises that approach to what we think we do for our communities around us, in a local manner, but also, you know, globally in terms of your research. But I think as a civic institution, we want to be contributing to civic debates and conversations. And this mental health is one of the priority conversations that we can be involved in. So for the institution, that's really, really important that you're epitomising the approach that we would like many of our researchers to take the bench science and take it into the community and try and transform people's outcomes. That for us is really, really important.